And now to our other top story tonight. A measles case confirmed in a young child on Oahu. It is the first case reported in Hawaii this year amid a concerning resurgence of the virus nationwide. Our Dylan Ancheta joins us with the urgent message from state health leaders.
The governor and health leaders are encouraging residents of all ages to get vaccinated. While it is not a highly deadly disease, the worst of cases can be fatal, and it does spread very easily.
Please, humbly, get the MMR vaccine. That is the way to stop spread of measles. It's the way to avoid getting measles.
The governor and health leaders announced Tuesday Hawaii's first case was in an unvaccinated child under 5 years old. Symptoms were noted after the child returned from international travel with their parents.
As you've heard before, yes, vaccination is a personal choice, but it's also a choice to protect your neighbors and your community. So it's personal, and we take personal responsibility because that's our values in Hawaii.
The child is too young to be enrolled in a DOE school. However, officials have released information on possible points of exposure. March 30th, the Daniel K. Inouye International Airport sea gates, customs and baggage claim between 10:50 a.m. and 2 p.m. On April 4th, Terminal 2 departures, TSA checkpoints, and gate area for Delta Flight 309 to Atlanta, Georgia between 1 and 7 p.m. The Manoa Valley District Park art class on April 1st between 9 and 10 a.m. and the Kapahulu branch of the Queens Island Urgent Care on April 4th between 8 a.m. and noon. State epidemiologist Dr. Sarah Kemble says they have at least a dozen people ready to help with contact tracing as needed.
For measles, this is actually an age-old illness, unfortunately. So we are very familiar with measles. We have done these investigations over the years. Our last reported case was in 2023, thankfully with limited spread, so there wasn't an outbreak that occurred because of that case.
Hawaii now joins at least 22 other states with a confirmed measles case. It is highly contagious for both unvaccinated children and adults.
It'll be fevers. There's something called Kopik spots, which is these white spots in the inside of your mouth. A rash, kind of the red pinkish eyes. The kid will have malaise. That means you're just not feeling good.
Some cases can worsen to other health problems, but only about 1 in every 1,000 are fatal, which is relatively low.
And the best way to prevent an outbreak has already been said, and we'll reiterate a few times, is to have a high community vaccination rate. Because measles is so infectious, 95% of the community needs to be vaccinated in order to prevent an outbreak.
The state also said a member of the same household with similar symptoms is being monitored for a possible infection. If you're concerned about exposure or vaccine status, you should contact your healthcare provider. Dylan Ancheta, Hawaii News Now.
Thank you very much, Dylan. And the news of measles now in Hawaii has many parents with young keiki concerned about possible exposure.
My youngest, he's had the first vaccine, but he's a month shy of having his second one. I even called his teacher and I was like, I might have to pull my son out until he can get the second vaccine. Now we have parents that are vaccinated making the choice to not vaccinate their children because of misinformation on the internet.
Children should receive 2 doses of the MMR vaccine. The first dose is given at age 12 to 15 months and the second dose at 4 to 6 years of age. If you would like to get an MMR vaccine for yourself or your child, just contact your healthcare provider. You can also find a vaccine provider at vaccines.gov.